In this video, we're going to take a brief introduction to survival analysis. And to understand survival analysis is to understand that we're talking about what are called event history models. And in these types of statistical scenarios, the major question that we are fundamentally asking in an event history model and survival analysis is how long does it take for a particular event to occur over time? And so what we need to first do is to define a particular event of interest. And these are all taken over the course, as I indicated, of time, and the duration of that time is defined by the researcher, and we'll cover some of that here in this introductory and subsequent lectures. Some examples of event history models include the time to reoffend when released from incarceration. So people that are incarcerated that are given parole or just outright released, do they reoffend? And how long does it take for them to reoffend? And so in asking a question like this, researchers will focus on various factors or predictors that would influence that time to reoffend. Following a course of medical treatment, how long would it take for symptom relief to occur? Understanding that not everybody would respond to that medical treatment the same way. So a event history model would track that over a course of time among a group of individuals seeking that medical treatment. A more common application for survival analysis is to assess lifespan or mortality time following a cancer diagnosis or a diagnosis of some other disease or condition. And so this third example here is really examining the survival of a person in a particular situation. And the statistical model is based upon that length of time to the event and given certain predictor variables. And so we looked at just a couple of possible predictor variables. One could be a medical treatment, one could be a particular social program that would affect that time to reoffend. So there are a wide range of these types of variables, and because they're measured over time, a survival analysis would be appropriate. And so when we're tracking something over time, this is called an event history analysis. And the event history analysis is really the fundamental aspect to survival analysis. Now, specifically, what survival analysis attempts to do is to generate some sort of statistical model as a function of time to the point that a patient survives, hence the term survival analysis, following a medical treatment or a diagnosis. And so, and as a function of a particular cancer treatment or an organ transplant, these are just two examples of where a survival analysis approach would be appropriate. So the ultimate question here with survival analysis is to ask what would be the influence of predictor variables on the time to that event. And so some examples of these predictor variables include age. So if a person starts a treatment or is diagnosed with a disease, is the survival of that person going to be a function of age? So are younger people more likely to survive a longer time than older individuals? Their initial health status at the time of a diagnosis. Is the person a smoker? So we can apply a dichotomous scale, a dichotomous predictor here as well. Are there underlying medical issues? Does the person have a particular diet that would influence that time to the event? Now, in terms of setting up a research design here, the first stage is that the period of the study needs to be identified by the researchers. So example, a 3-year period of data collection. And researchers have a wide range of reasons for defining the period of the study. Oftentimes it has to do with resource allocation, or other times, if resources are not a particular problem, researchers may base that period of the study on the particular condition and the time it usually takes for a condition to manifest. So this is all time-based monitoring in this type of study design. Data is collected on predictors as defined by the researchers. So a person's age, their health status, underlying medical issues, their diet, so on and so forth. So a wide range of information is initially collected. And then the patients enter the study, so they officially become a research participant. And then the patients or participants are followed over time, and that it requires that follow-up by the researchers. Now, it's important to note here that over the 3-year data collection period, if that's the data collection period identified by the researchers, participants can be entered at different times, not necessarily at time 0. So the one key aspect to survival analysis is that the period of the study is fixed. That's the first stage. And then a patient could be entered into the study after the first year, after the first year and a half, or even the second year of that data collection period. And so what the researchers are looking for is the occurrence of the key event in question based upon the research study. And so the particular event may be death, resolution of symptoms, or the reemergence of symptoms, the time to diagnosis of a particular disease. So patients that are HIV positive may not have acquired immune deficiency syndrome, which is the disease caused by the virus. So the actual diagnosis of AIDS would be the event in question here for this type of research study. The tracking a person's return to work following a particular work-related injury and entering into a physiotherapy program or other sort of rehabilitation program. A survival analysis could be used as well, although return to work in itself is not necessarily survival based upon the key definition of these types of typical studies, but the return to work could be used as a reason for conducting a survival analysis. So this first brief video ends here with this basic definition of survival analysis.